Hello, we are first-year practical nurse students at Red Deer Polytechnic, and today we are going to provide information on pain and comfort management for the older adult. Pain and comfort. Pain can be described as a physical sensation, which can include psychological effects on an individual's cognitive, behavioral, and sensory components. It is important to note that comfort can be a state of physical ease and freedom from pain and anxiety, as well as a form of satisfaction of all bodily needs.
Hi, my name is Jaden Demchuk. I'm a student practical nurse at Red Deer Polytechnic, and I'm here to speak upon the principles of pain and comfort management and how it targets healthy aging. Luckily, there are many ways to manage pain and comfort, and this will overall contribute to an optimal aging process. For example, we can learn how to incorporate a healthy, active routine into our daily lives to obtain the highest quality of life for ourselves. A saying I like to use to best explain it is a move it or lose it principle. This means if we are not in a frequent active lifestyle, our bodies can become stiff and sore. For instance, if we spend all day sitting on the couch and not standing for long amounts of times, we will begin to feel the aging process faster within our bodies, ultimately leading to higher levels of pain and discomfort. Pain is defined as the personal experience that is influenced to varying degrees by biological, psychological, and social factors. It is an unpleasant sensory and emotional experience associated with or resembling potential or actual tissue damage. Comfort is defined as a state or situation in which you are relaxed and do not have any physically unpleasant feelings caused by pain, heat, cold, etc. So with that being said, we ultimately need to keep as pain-free as possible so we can maintain mobile throughout our lives to obtain an active routine which will help aid in overall healthy aging. A great way to start a more active, pain-free lifestyle is to engage in a strength and conditioning program, participate in a sport you love, or even just simply going on a daily walk. If we're able to maintain these daily habits consistently, the results are proven to ensure a healthy aging process. Thank you.
The affect of pain and comfort management for the older adult. Quality. Pain and comfort management contributes to healthy aging in many ways. By creating coping skills and having the education to manage pain, people within the older population can increase their quality of life and progress to a more active lifestyle that allows them to have optimal mobility and a sense of independence.
Hello, today we'll be talking about the CCPNR Entry to Practice Competencies and Centers of Practice for Licensed Practical Nurses and how it's applied to the pain and comfort management for the older adult. In Canada, Standards of Practice for Licensed Practical Nurses provide a framework for LPNs to practice. These Standards of Practice define the legal and professional expectations of an LPN. In combination, the Code of Ethics for Licensed Practical Nurses outlines an understanding and agreement of expectations along with requirements to practice. Licensed practical nurses have set principles to uphold. They must be self-regulating, accountable, responsible to provide safe, competent, ethical nursing practice and work collaboratively with the clients and other healthcare providers. Practice is client-centered, involving individuals, families, groups, and communities. Standards provide the structure to support the LPNs to meet the needs of the population in the Canadian healthcare system. Practice requires individual leadership and professionalism as it is demonstrated through their commitment to continuing competent, continuing education, and safe ethical practice. Standards of practice when considering pain and comfort management for the older adult provide holistic evidence-informed practice that supports the concepts of health promotion, illness prevention, health maintenance, and restorative care. The patient must be informed on health promotion, illness prevent, and maintain health wellness. Have the education to apply the nursing process involving assessing, diagnosing, planning, implementing, and evaluating. In doing so, this determines if the correct plan of action was implemented. Using collaborative approach in the analysis, development, and implementation and evaluation of practice and policy to guide evidence-informed, client-centered care. Patients must be informed of treatment, the right to refusal of treatment with the proper teaching. leading and contributing to practice culture that promotes safe, inclusive, and ethical care. A safe and supportive environment for the patient needs to be set for their healthcare journey. Provide relevant, timely, accurate information to clients and healthcare teams. They must be provided to the patient timely, given the appropriate information for the patient to make a decision based on the information provided by the healthcare team. By advocating for the protection and promotion of clients' rights to autonomy, confidentiality, dignity, privacy, respect, and access to care and personal health information. All patients have the right to access health care, keeping intact their autonomy and dignity. We must demonstrate effective, respectful, collaborative, interpersonal communication to promote and contribute to a positive practice culture. Doing so, focusing on a plan, keeping the patient's best interest first. Thank you.
Hi, so let's talk about how to promote health in pain and comfort management in the older aging adult as a practical nurse learner. The main aim is to promote health by effectively addressing pain to improve patient outcome and quality of life. Here are some strategies to promote health in pain and comfort management in the older aging adult. Pain assessment. Effective pain management begins with accurate pain assessment using common tools like numeric rating scales, which help patients rate pain from 0 as no pain to 10 as worst pain. Patient education. Educate patients about pain management techniques, which include meditation, exercise, repositioning, stress management, and relaxation technique, ensuring they understand their treatment plan and the importance of following it. Empathy and communication. Listening to patients' concern and validating their feelings. Communication can help build trust and make patients feel more comfortable discussing their pain. Non-pharmacological intervention. Encourage the use of methods such as heat or cold therapy, massage, and mindfulness practice can complement medical treatment and provide additional relief. Advocacy. Advocate for patients by coordinating with other healthcare professionals and ensuring that pain management is patient-centered. Support system. Encourage patients to connect with families and friends, as this study has shown that these relationships can play a vital role in pain and comfort management. Additionally, I can suggest that keeping a pain journal to help patients and their caregiver track pain level and triggers. Continuous learning. I'll be staying updated with the latest pain management practice and research. This will help me provide the best care possible and adapt to new methods and treatments. By combining these strategies, I can effectively promote health and improve the quality of life for my patients dealing with pain and discomfort.
The determinants of health are listed as income and social status, employment and working conditions, education and literacy, childhood experiences, physical environments, social supports and coping skills, healthy behaviors, access to health services, biology and genetic endowment, gender, culture, and race. Many of the social determinants of health are affected by the quality of pain management. Someone who is experiencing pain of any form may struggle with the determinants to healthy living and aging. If pain becomes unmanageable and a level of comfort cannot be achieved, it can become difficult or sometimes even impossible for someone to maintain their healthy behaviors, such as keeping up their appearance, brushing their hair, bathing, and hygiene. For others, their tasks of daily living may be affected, like making it to the bathroom or being able to cook for themselves and run errands. It can have negative effects on their mental status and their personal relationships. In today's society, it can be difficult for persons within the older age range to reach good quality health services and access the social supports that they require, which can in turn have an effect on the development of healthy coping skills to manage their pain and encourage a sense of comfort. This results in a cyclic effect that can be detrimental to the older person's overall health and aging. As nurses, it's important to provide proper patient education and offer support systems that will aid in the management of pain and comfort.
Student's message. The key message to our older population is pain is perceived differently by each individual. However, there are preventative measures and ways to cope and manage it. Pain is unique and experienced by many, making it the nurse's job to provide the best quality care that is unique to the patient so that their needs are met and the best level of comfort is achieved.